I don't know that there's any trends in coaching and fitness right now. I think what's happening is some of the fitness trainers are getting more curious about adding coaching skills to their fitness practice. And that means that that coach approach may be just the ideal situation, the ideal kind of technology in order to get people to really adhere to their fitness regimens, whatever they are. Normally, personal trainers, fitness trainers, exercise instructors have had that sort of same top-down authoritative approach to imparting their fitness information just as the rest of the healthcare profession has, which is, I'm the expert, here's what you should do. We know from coaching research that there's a better way to go about co-facilitating, evoking, finding someone's intrinsic motivation and actually helping them take those first steps, have them discover their solutions, their insights for moving forward with fitness. So I've done some work within the fitness industry. I'm editor-in-chief of American Fitness Magazine. I've been with an organization called AFA for a long time, in addition to the National Consortium for Credentialing Health and Wellness Coaches. And what we found is that we have a lot of lessons we can learn from the fitness industry and how they went about certifying their fitness instructors and personal trainers. So as we embark on this national certification for health and wellness coaches, we have some lessons that we've learned from the fitness industry and what happened with certification there. In other words, there's a lot of fitness instructors out there who have taken a written test only. And we know that any kind of healthcare professional, even allied healthcare professionals, should demonstrate their practical hands-on knowledge. There should be an opportunity for them to say, well, if I'm working with a diabetic, what kind of coaching questions would be modified for that versus coaching questions for executive or anyone else that works without a chronic disease? How do I actually work with somebody with the body issues that are so important and intimate? We really need to see how that coach asks the questions and guides and co-facilitates and sets up. So that part of the certification process is called a demonstration of practical proficiency of their skills, not just a written test. Within the fitness industry, a lot of certified fitness instructors just take a 150 multiple choice test, and they never have a chance to really demonstrate what they know in a practical way. They never have that practical certification exam. So that's the biggest lesson that we can learn from the fitness industry as we roll out a national certification for health and wellness coaches, is that it should be a two-part. Yes, we need the knowledge tested well, and a written test can do that. But we also have to find a way to really certify that those have had a professional competency in that kind of hands-on practical demonstration as well. Without clear skill testing, we can see real problems evolve. For instance, would you want a surgeon who never had to demonstrate their practical skills operating on you? No, of course not. So good schools, accredited schools, medical schools, have that way of testing the practical and assessing those skills before any kind of national board, national certification, or licensure is in place. So what we've seen lately, there's a lot of media frenzy about the rising injury rate within fitness training. There's even been some deaths lately. So we've taken a harder look at what is the fitness training certification in place. And when we discovered that a lot of these fitness trainers only have taken a written test, they never had a chance to actually demonstrate through a practical skills assessment their proficiency with working with bodies. So this is a huge error, I think, and something that has really alerted us to the fact that with health and wellness coaching, we need a two-part certification process. Not only the knowledge base, but also the practical assessment of skills in the coaching conversation, the coaching alliance, the relationship. There's different ways to measure a practical exam and to actually put one in place. Right now at the National Consortium, we're looking at, do we accredit various training programs that have a certain prerequisite to even enter the training program? What is the faculty credential? What kind of assessments take place? Is there going to be mentored coaching observation? How many hours of it? So this is going to be a dialogue that goes on for, we think, the next 6 months, 12 months, we're not sure yet, but we're trying to be inclusive as many stakeholders and training and educators as possible in that process. We've also done a large survey of health and wellness coaches, those who are in the field and working right now, looking at both the frequency of various tasks and the importance of those tasks. In this survey, that's our first step, is this job task analysis. So this is a long and arduous process of putting together national certifications. When you look at the certifications and licensure and accreditation, all the process that's happened in healthcare professionals before this new emerging health and wellness coaches, we see that there has always been practical assessments of skills and theoretical knowledge testing. That two-step is so important and something that we're going to adhere to. How is a question of putting together a lot of great minds, more than I could answer for you here. There's a definite need for standards within the field of health and wellness coaching, just as there's a need for standards within all the healthcare professions. The public safety is urgent right now. There are folks that can go online, write in a website, and get a health coaching certificate overnight. It's kind of crazy out there. And so what we're looking at is establishing a training and education standard that says that you need to meet this educational standard, this benchmark, this minimum is so important because you're working with people on major issues of health, diet, exercise, stress management, relationships. That is a major responsibility for a doctor or a nurse or any health professional to say, I need my patient to follow this, and to hand that over to a health coach. That health coach has to have a certain modicum of knowledge, practical experience. They have had to have educational testing. They need their practical skills assessed and evaluated. And they need mentored observation. Just as becoming a therapist needs to be supervised, we believe now that health coaches, wellness coaches also need that kind of supervision and mentored oversight. And that's for public safety, number one. Also, it's because of the elevation and professionalization of the field itself. Anytime an emerging profession arrives on the scene, it's kind of renegade. There's all sorts of overnight certifications and ones that we should probably say public beware. Eventually, though, the field is growing up, it's maturing, and those training and education standards are evolving now with a large inclusive process of many important stakeholders and educators in the field. And a lot of that is directed by coaches who've been out there and practicing for a long time. And so we're getting that wonderful information from them, along with groups like the International Coach Federation. And together, the National Consortium for Credentialing Health and Wellness Coaches expects to have this evolved by late 2015, really. I'm going to go out on a limb and say we really think we'll have the trainings and standards out by then, along with a rollout of a national certification exam within the next 2 or 3 years. Perhaps the most important reason for evolving training and education standards within the health and wellness coaching field is because we are looking at outcomes and assessments, and we're trying to really evaluate the effectiveness of health and wellness coaching. We have some great research right now, but it still needs this sort of agreed upon basis of what the training is, what the education is, what the defined principles of health and wellness coaching are. From there, we have research that is solid and valid.